Okay, good night. I'm here to do my checkup for IV infusions as a primary line. Okay, first I has to have my doctor orders like this for the electronic medical records to see what my doctors prescribe for my patient. I'm going to introduce myself. Hi, I'm Kelly Spertus. I'm the nurse student for today. Can I have your name and date of birth? Okay. Do you have any allergy? You have allergy for penicillin. What is the reaction? What do you have when you has the allergy? You have hives? Okay. I'm going to let you doctor knows about your allergy for penicillin and your reactions hives in your body. Okay. Now let me confirm that I have the same patients. I using the wristband. My patients has to confirm that she's allergy. Have the date of birth and the full name. Okay. Mr. Pawlowski, I'm going to educate you what I'm going to put in your body. I'm going to infuse in you sodium chloride. That's my pharmacology sheet, worksheet. This is sodium chloride. The route is going to be IV. Is 125 milligram per hour. That's your dosage. Also, it's your dosage, and this is going to be at 14:48, like my medical record says. It has to be by IV. Okay, I'm going to document it as soon as I start my infusion on you. Okay. Also, I educate my patients and talk to myself. Now I'm going to sanitize my hand because I have to inspect your arms. How is the IV, the injection points look like right now? For me, okay, the injection size is look intact. It's no any redness, edema, swelling. Also, it's no signs and symptoms of filtrations of phlebitis. That means if I see any symptoms and signs of phlebitis or filtrations, I had to change all this stuff. I'm moving to the now with the arms for avoid any complications. Okay. I really sanitize my hands. I inspect my patient's arms. I did my 6 rights. I'm going to inspect right now. I will be back, Miss Anna. I'm going to grab all my stuff. Okay, and then medicine room to grab my inspect and grab my IV bag. This has to see not any cloudiness inside my bag. The package before I open it has to be intact and has to be not expired. Okay. Also, I has to label with the day. Today's day is May the 26th. I has to put the name of the medicine. For now, this is 0.9% sodium chloride, and the dosage is 125 ml per hour, and my initials, this KP. Okay, this correct right now. Now I did my 6 rights. I inspect I inspect my bag. Okay, I'm going to calculate my trips con the information the doctor give me in electronic medical records. For that, I grab my white board. I have 125. This look awful. Okay. I don't know if this can be same. Okay, I have 125 ml over 1 hour. That means 60 minutes. Time. The drop factor is on the package on my IV bag. Is 10 quarters over 10 over ml. That will be equal 21 quarters by minute, because the ml we eliminate. That will be my drip rate that I'm going to infuse in my patients every minute. Okay, let me put this away. Put it away. And then after that, I have to inspect. I will be back to my patient's room. I'm going to do my this right again. I have the right patient. I draw my medical records. I have the right patients. Anna Pawlowski, the day of birth. She's the day of birth. The dosage is going to be 125 ml. Their route is going to be in IV infusion continuous. The day is 5:26, time 14:58. I'm going to document it when I start my infusion. Okay, now I'm going to inspect my tubing line. I have there here. I open it. This is the package. I open it. This is my IV tubing. I have to make sure that everything is clumped. This is the roll clumps, and there has another ones in the end. Okay. This I'm going to attach. I also has to label with the time, the date, and my initials. I have to attach this, the IV tubing to my IV bag. This part is for medication, and this part is for connect my IV tubing with my IV bag. I spike it, I switch it like this. I'm going to squeeze my drip chamber, the 1/3 or 1/3 or 1/2 full. I'm going to put this on the IV pole to continue my process, to connect my IV tubing with my injection port. Okay, now let me be clear. Okay, before I connected my IV tubing with my injection port, I have to prime I inspect my IV tubing. Okay, that's what I do. Let me just put it this protective way. I have to prime my IV tubing. I have to open all the clamps first. Open it, the little ones. Just open it, and then using my roller clamps, I'm going to open it slowly. But the end of this, it has a little blue cap. I'm going to open. Sometimes you cannot open, just leave it to see if any drop, but I have to allow just two gutters coming out. Okay, I'm going to prime my line. Let me see if at least the clarity is not covered right now, so you guys can see. Okay, let me see if you can see from here the two goats. I open it, my room. Okay. One, and two. Okay, I close my roller clamp, and then my roller clamp, and then I put it out here while I'm going to. I have to check if my tubing IV tubing doesn't have any air bubbles. If it has any air bubble, I have to type it. I forgot to tell you, I have to grab all my supplies, my globes, my saline flush that I'm going to use, and also my alcohol pad to working in my IV sides right now. I sanitize my hands. I put in my gloves. Put in my gloves. I have to have my saline flush close to my, because I have to see if it's something is correct. Okay, now I'm working my IV sides. I open the clamp. I clean up first with alcohol pad. On my IV port like this. Okay, I open my saline flush syringe, connect it, press. Okay, what I'm going to do right now, I'm going to aspirate for see if it's any blood returns. If I see, okay, I have to verbalize that. If I don't see any blood return, I have to check my IV site for any signs, symptoms of filtrations or phlebitis. Also, if I don't see any the symptoms, I have to slowly get push or flush 3 ml slowly. Also, if I feel any resistance when I flushing, I have to inspect that the clamp is open, right? If if this is open, I still feeling resistant, I have to immediately change my IV size because it's not correct. It's not connected correctly. I have to remember that we cannot force the flush getting into my patient's arm because it's going to cause embolus. Okay, now slowly I'm going to push uh, 3 ml inside my patient IV port. Okay, go. Okay, okay. Now I'm going to disconnect my IV flush. I'm going to connect it with my IV tubing like this without contaminated. This cannot be on the floor or on the surface because it's going to contaminate. I'm going to just push and I have to secure with that tape that the patient cannot move or anything this part. Okay, now with my second hand watch, I'm going to calibrate my drops. The calibration is I have to count for 1 minute 21 gotas in 1 minute, or can count 10 gotas in 30 seconds. Okay, after that, has to document that I did my infusion. I start my infusion on my patient. Okay, when after I documented, and then has to monitor my patient for any filtrations or phlebotomy signs, symptoms. Also, I have to check that everything is okay with my patient. Any reaction with the medicine I just put it to start infusion. I'm going to take my gloves off. I'm going to take my gloves off. When this is complete infused, I'm going to grab my another supplies that I need: a gloves, a bread cup, and my alcohol pad to take all this stuff. And also my saline flush. Okay, my saline flush. Sanitize my hands. Okay. Also, I forgot to tell when I clean up this port, I have to let this air dry. No, I cannot just blow or giving some air. No, it has to be air dry. Okay, let me put my gloves to remove all the IV tubing from my injection port. Okay, okay, what I'm going to do is I'm going to clamp, or I'm going to close all my clamps my roll clamps. I close that. I disconnect it. I'm going to disconnect this. I'm going to leave it here. Using my red cap, I'm going to close the end of my IV tubing. I put it away from my patient because it can be used again. Now I'm going to work in my patient's IV side. I open another alcohol pad. Clean it. Rub it. Okay. With my IV flush, I'm going to flush without aspirate because I don't see any more blood return. Okay. I'm going to slowly flush with 3 ml. Okay. I have to open. Okay. I flush it. Close my clamp. Take care of this. Usually, sometimes in the hospital they provide another cap for the IV side, for the injection port, to keep this port closed. But now I'm going to use another red cap to keeping this port closed. Okay, I'll open it. I'm just going to attach and close that for maintain this port closed. Okay, I have to take care of all my supplies, take care of this off out on my table, my patient's side. Okay, and now I'm going to bring ask my patients to say if you feel comfortable or not. Miss Hannah Pawlowski, are you feel comfortable? Let me put your bed in safety position, the lower positions I can put it. Use side rail is up. This is your cold bed, is your knee. Do you feel well? You feel comfortable? Just let me know if you see any changes, something like that. Okay, I'm going to remove my clothes because I finished my assessment. I documented that I finished, and then I wash my hands. Thank you.